Hi, I'm Dr. Jinny Gunn. I'm a surgeon with Bay Surgical Specialists. I'm also a mom, a former Navy military member, and an advocate for breast health care. I became acutely aware of the effects of breast disease when my aunt was diagnosed with stage 3 breast cancer. It impacted the entire family, and we rallied together to help her. Her struggle inspired me to specialize in breast disease and surgical oncology. I did my residency training at Mayo Clinic in Jacksonville. I worked with some of the nation's top surgical oncologists. It gave me special insight into patient-centered care and exposed me to state-of-the-art surgical innovations. Today, I want to walk you through your experience with our care team and what you can expect surgically before, during, and after a biopsy and diagnosis. Many of our patients come to us directly, or some are referred to us through their primary, a gynecologist, or their oncologist. During the initial appointment, our team will greet you and get you comfortably prepared in an exam room. We'll perform an exam, discuss your medical history, and answer your questions. This time together also helps us to understand your wishes during your treatment and lets our team begin coordinating the necessary steps for your care. Our philosophy is to treat the whole person, not just a surgical site. We know that by focusing on the mental and physical aspects, we can have better long-term outcomes. Communication is incredibly important, and we want you to feel that you have the support, resources, and access that can help you make the best healthcare decisions for you. We have assembled a booklet of local resources that includes support groups, diet, meditation, yoga, and more that can help during and after your care plan. We work with a team of radiology and oncology specialists to identify and diagnose areas of concern. A mammogram, a biopsy, and lab work will be performed. There are many types of biopsies, and we can prescribe the type of biopsy that is the least invasive and most accurate for the detected abnormalities. Some biopsies involve only a needle stick, while others may require a surgical collection. Some may be done in our office or require an outpatient visit. We will try to make you comfortable during your biopsy, and downtime should be minimal. After the results of the biopsy return, you will meet with your care team to review them. If there is a positive result or a result that requires further investigation, we will review your options and together decide what comes next. At this time, we will most likely be able to determine if cancer treatment is required. For some, surgery may be used alone, while others may need more inclusive treatment plan with radiation, chemotherapy, hormone therapy, or targeted therapies. Surgically, we will discuss if a lumpectomy, mastectomy, and/or removal of nearby lymph nodes are the best option. A lumpectomy and mastectomy have equal long-term survival rates, and there are many pros to performing the least invasive procedure possible. My goal is to remove all of the cancer. When we discuss surgery, I will give you an individualized treatment plan. After your surgery, your post-op care will depend on your procedure. Patients who undergo a lumpectomy should experience a quicker recovery time and require only moderate pain medication. Patients who undergo a mastectomy will have a drain to help reduce swelling and will be visited by our home health care team to help care for the drain for about a week. The home health care team will also help monitor your pain and watch for potential signs of infection. After about a week, you will return to our office and have the drain assessed and removed. Once the primary surgery is complete, patients may require additional operations if cells regrow or cancer spreads. Patients may also have a port placed surgically into the chest to deliver systemic chemotherapy. All of these options will be discussed as needed. I know you may have questions about your physical appearance after a procedure. We will discuss your options to having skin sparing, nipple sparing, and oncoplastic techniques as part of your procedure. There are also reconstructive procedures if you choose that route. Some may not choose reconstruction at all. I do not perform plastic surgery procedures, but a plastic surgeon can be integrated into your care plan when you're ready. I often get asked about performing genetic testing and performing preventative mastectomies. Most breast disease cases are hormone related. Your hormones are unique to you, your experiences, and your exposures. Genetics plays a role in about 10% of breast cancer cases. There have been high-profile cases that brought genetic testing and pre-cancer mastectomies to the spotlight, but cases that warrant this kind of radical treatment are rare. If you have questions about genetics being a factor, we can schedule a consultation and investigate if genetic testing should be explored. What I want you to take away from today is the comfort that you are not alone at this time. Our team is here to hold your hand and guide you through this process. You have the power to make the best decisions for your healthcare, and you can rely on us for expert advice and state-of-the-art surgical procedures. We are here to facilitate your surgical care and make this experience as hassle-free as possible.